Yo, nursing students, get hyped because today we are mastering the APGAR score. This is your bread and butter in the delivery room. All right, look at the clock on the board. APGAR isn't just a one and done thing. We perform this rapid assessment twice. The first check happens at the 1 minute mark to see how the baby's doing right out of the gate. Then we do it again at 5 minutes to see how they're transitioning to the real world. The whole point is to evaluate how well this little human is adapting to life outside the uterus and to decide if we need to jump in with any nursing interventions immediately. Coming up next, we're diving into exactly what those letters stand for, so stay tuned. Now listen up, because this is a classic exam trap. The APGAR score is not a crystal ball. It does not predict the baby's long-term health or future intelligence. We use it strictly for immediate decision-making right there in the room. Are they breathing? Is the heart beating fast enough? That's our focus. Moving right along to the actual acronym. Let's see what each letter actually stands for. Boom! Here it is, the legendary APGAR acronym. Let's break it down. First up, A is for appearance. We are looking at the skin color. Is the baby pink or are they turning blue? P is for pulse. This is the heart rate, and honestly, it's the most critical part of the whole score. G stands for grimace. This is the reflex response. How does the baby react when we stimulate them? The second A is activity. We're checking muscle tone. Are they flexed and moving, or are they limp like a noodle? And R is respiration. This isn't just counting breaths, it's the effort. Are they letting out a lusty cry or just gasping? Now that we know the letters, let's get into the nitty-gritty of the points. Let's talk points for appearance. You can get a 0, a 1, or a 2. A 0 means the baby is pale or blue all over. That's a sign of poor oxygenation, and we need to move fast. A score of 1 is super common. The body is pink, but the hands and feet are blue. We call this acrocyanosis. It's usually okay. And a 2? That's the goal. Completely pink from head to toe. Great oxygenation. Next up is the heart rate, the big one. Let's see the numbers. All right, pulse. This is where we pay real close attention. 0 means no heartbeat. That is a full-blown emergency, total code blue situation. If the heart rate is less than 100 beats per minute, we give it a 1. This is inadequate perfusion, and we've got to intervene. 2 points goes to a heart rate of 100 or more. That's what we want to see in a healthy newborn. Moving on to grimace and how the baby reacts to us. Grimace is all about reflexes. It tells us how the baby's nervous system is handling things. 0 means the baby doesn't react at all when we stimulate them. That's definitely concerning. A 1 is a weak response. Maybe just a little grimace or a small movement. It shows some mild depression of the system. A 2 is a strong cry, a cough, or even a sneeze. That's a great neurologic response. Next up is activity. Let's look at those muscles. Activity is just a fancy word for muscle tone. 0 is when the baby is completely limp. This usually points to some severe depression of the central nervous system. 1 point if there's some flexion. The baby isn't totally floppy, but they aren't super active either. And a 2? That's an active baby. Arms and legs moving around. That's what we love to see. Last letter, R for respiration. Let's finish the scoring. Finally, we have respiration. We're looking at the effort they're putting into breathing. 0 means no breathing at all. This requires immediate resuscitation. We don't wait. A 1 is for slow or irregular breathing. The baby is trying, but they definitely need some support to get going. A 2 is that beautiful, strong, lusty cry we all want to hear. That's a perfect score for respiration. All right, we've got the individual scores down. Now, how do we interpret the total? Let's check it out. Once you've checked all 5 categories, you add them up for a total out of 10. Here's what those numbers mean for your patient. A 7 to 10 is normal. The baby is adapting well, so we just provide routine care, warmth, drying, and bonding. 4 to 6 indicates moderate distress. This baby needs help. We're talking interventions like stimulation or oxygen, and we're watching them like a hawk. 0 to 3 is severe distress. This is an all-hands-on-deck emergency. Immediate resuscitation is required to save this baby's life. Now, as a nurse, you need to know your priorities. Let's look at the flow of action. Listen close. If that APGAR score is below 7, you have to move through your priorities fast. It always starts with the airway. First, get that head in the sniffing position to open the airway. Then, grab your bulb syringe. You suction the mouth first, then the nose. Remember, M comes before N, mouth then nose, every single time. Next, we check on breathing support. Let's see how we help them take those breaths. Step 2 is all about breathing. Sometimes the baby just needs a wake-up call. We stimulate by drying them off vigorously and rubbing their back. If that's not enough, we move to supplemental oxygen. And if they're still struggling, we break out the bag mask ventilation to breathe for them. Now, let's talk about the heart. Step 3, circulation. Pulling up the circulation protocol. This is high stakes. Circulation is all about that heart rate. If the heart rate is under 100, we're assisting their ventilation. But look at this next number. If the heart rate drops below 60, you start chest compressions immediately. 60 is the magic number for starting CPR on a neonate. We can't forget about keeping them warm, though. Step 4 is temperature. Babies lose heat fast, and cold stress makes everything worse. You have to dry them off right away. Use warm blankets or get them under a radiant warmer to keep that body temperature up. We keep watching them after the initial score too. Let's look at ongoing monitoring. Don't stop after that first minute. You repeat the APGAR at 5 minutes. If the score stays low, you keep reassessing every 5 minutes. You don't let up until they are stable. All right, let's put it all together with a real-life example. This is how you'll see it on exams. Okay, picture this. You're in the room, and here's what you see at the 1-minute mark. That adds up to a 5. Based on what we learned, what does a 5 mean? That's moderate distress. You aren't just standing there, you are acting. You're positioning that airway, stimulating the baby, giving oxygen, and getting ready for ventilation if they don't perk up. This is nursing in action. Let's finish up with a quick recap of the big takeaways. All right, nursing crew, that's the APGAR score in a nutshell. Remember your acronym, know your point values, and always prioritize the airway first. 7 or higher means the baby is golden. Anything lower, and you're stepping in to help that transition. You've got this! Study these priorities, and you'll crush your exams and be a rock star in the delivery room. Drop a comment below if you want more videos like this or have a specific topic you're dying to cover. If you've got questions, fire away. I'm here to help. Thanks for watching, and I'll catch you in the next one.